Your body is alkaline by design and acid by function. Normal body pH is 6.4 to 7.0. Ideally, you should start the day with a body pH of 6.9 to 7.0 upon awakening. As the day progresses, your body accumulates waste byproducts, and your pH should slightly decrease to 6.4 to 6.6 until the body discharges the waste via your liver, kidney, or lymphatic system. Now, I have found that many chronic illnesses begin with a patient being acidic. In other words, they suffer from low pH. In the beginning, the patient feels fine, but since their pH is acidic, it's a slow spiral downward toward poor health. Add in the fact that you're not creating methyl groups because of the low hydrochloric acid in your stomach, and it creates a recipe for disaster. Why? Number one, buffering the blood. When you're acidic, your body leaches minerals out of your bones to buffer your blood. And this is not good because you are on the road to osteopenia or osteoporosis. Number two, heavy metal toxicity. When you're acidic, you're at a greater risk for heavy metal toxicity, which in turn causes a downward spiral of free radicals. Calcium lines the brush border cells of the gut to prevent the absorption of heavy metals. And when you're acidic, you have lower levels of calcium, magnesium, and other trace minerals like selenium and zinc. In addition, lower levels of essential minerals allow for the creation of free radicals in the body. Now, the mitochondria are the powerhouses of the human cell, and free radicals damage the mitochondria. In fact, mitochondrial DNA is 10 times more sensitive to free radical damage. But the good news is that this extreme vulnerability of mitochondrial DNA can be protected by targeted nutraceutical agents, the most profound of which is DHLA, the reduced form of alpha lipoic acid, which is now available in stable form for the first time in history. Now, DHLA promotes a dramatic increase in cellular ATP or energy and quenches every known free radical that can occur in living tissue. So, what can DHLA do? It boosts your ATP, it quenches every free radical that can live in human tissue, regenerates vital antioxidants like CoQ10, glutathione, NADH, and vitamin C and E. Now let's look at the importance of pH in the thyroid gland. Many doctors, physicians, chiropractors, or naturopaths are addressing thyroid issues, but they're not checking the patient's pH level. And in my opinion, this is a huge mistake. And here's why. The minerals that create an alkaline environment in the body, calcium, magnesium, and other trace minerals, are very important to the thyroid patient because every cell in your body has thyroid receptors, and every cell needs to be able to accept T3 to survive. And they cannot accept T3 without these minerals. If a patient has a low pH, guess what? They are low in these essential minerals, and they are unable to accept T3. Now, this may be one of the reasons why you're not getting better. T4 to T3 conversion is dependent upon zinc, and low levels of selenium will cause inactivity of this T3. So, should you be taking handfuls of zinc and selenium? Of course not. You need to get your body pH up and increase your stomach acid so that you can absorb the correct amount of zinc and selenium from your food. Zinc is found mainly in beef, lamb, veal, crab, shrimp, scallops, turkey, pumpkin, sesame and squash seeds, oysters, peanuts, and yogurt. And selenium is mainly found in tuna, cod, halibut, sardines, shrimp, salmon, beef, turkey, and lamb. Number 3, lowered immune response. Being acidic creates a welcoming environment for viruses and bacteria to flourish. Therefore, pH is a huge player in immunity. I strongly feel that part of the reason why we have this autoimmune epidemic in the U.S. is because of low chronic pH levels. If you have noticed that you're more susceptible to colds and flus, this may be the reason why. So, how do you check your pH level? It's a very simple process of checking your first morning urine after 5 a.m. with a pH test strip that are available at most drug food stores. Now, please note that one urine pH test is not sufficient. You need to check your first morning pH for at least a week and preferably 2 weeks to see a consistent pattern. Number 4, the parathyroid. The problem is that everyone and their uncle are addressing the thyroid gland with their patient population, but no one is addressing the parathyroid issue. The thyroid and the parathyroid work hand in hand, and the major function of the parathyroid is to maintain the body's calcium level. It buffers your blood. Everyone is addressing the thyroid without addressing the parathyroid, which is akin to exercising to lose weight but never addressing your diet. Now, yes, lab-wise you could check the parathyroid hormone, but if the calcium, phosphorus, magnesium, and/or vitamin D levels are off, there's a great chance that the parathyroid is not functioning and it needs to be addressed. If your parathyroid isn't working, guess what? Your blood will not be buffered, and you will be acidic. In addition, the parathyroid is the most sensitive organ in your body to heavy metal toxins. So, how do you correct low pH? Well, you drink plenty of good water, which by that I mean distilled water or filtered water. You need at least half your body weight in ounces. You need to make dietary changes, eat more vegetables, eliminate junk food and white death. By that I mean white flour, white sugar, white salt. And supplement with a quality green drink like Nutri-Greens. So, what if your first morning pH is over 7.0? What then? If the first morning urine pH is consistently over 7.0, the body is in severe alkalosis. The minute you make the necessary changes with a pH, your pH will crash to 4.5 or even lower. And I've seen this happen in a number of cases in my office, so I make sure I tell patients what will happen beforehand. Again, body pH is very easy to test with a box of pH test strips. Follow the directions on the box and make sure that this is the first morning urine after 5 a.m. Now, saliva pH testing is not as accurate because it hasn't gone through the body's metabolism. Now, trust me, I have already checked it on several patients. Their salivary pH is within normal limits, and then their urinary pH is very acidic. And both the salivary and urine pH were checked on the same time, or at the same time. I hope this helps.